Hi folks, my name is Nora and I'm joined here with
Sydney Pearce, and I'm a PhD candidate in the Department of Population Medicine, and I'm also doing my Collaborative Specialization in One Health.
And what introduced you to One Health?
So I actually was introduced to One Health at a conference, so similar to what we'll talk about today, but a professor came up to me and basically said, "Oh, your project seems like it's One Health." And I was like, "Oh, that's interesting. I'll look that up more." And I did, and actually at that point I realized that One Health really resonated with me and my work, so that's what introduced me.
And so you attended the Singapore World One Health Congress. What research did you present?
So yes, I did. The research I presented there was a scoping review of all the studies that self-indicated that they used One Health to inform their primary research, so research conducted by themselves, not a review of others' research. And basically we wanted to describe what One Health has been able to do to this point within that field. So we tried to describe the 5 W's and H. I'll break it up into the who, what, where, when, why, and how. So for the where, we saw that first authors predominantly were from North America and Europe, and then the study locations were within Africa and Asia. So there's an imbalance there, but over time we saw that representation was starting to become more even and better distributed, which is good. When looking at the what, so what did One Health research do, or what research topics were included? We saw a lot of infectious disease research, AMR research, traditional One Health topics from early definitions. But over time, we started seeing new topics like climate change and biodiversity, mental health, things like that. When looking at the when, the study started in 2010, so I know that One Health was coined back in the early 2000s, but it takes some time for research to come together and be published, and specifically looking at primary research, not One Health commentaries. So yeah, the article started in 2010, and then our search date was in mid-2021, so we got about 11 years worth of data, which is, good amount. So yeah, we had that period of time, and over half of the articles were between 2020 and 2021. So we know that One Health really gained popularity in recent times. And then when looking at the why, so why were these studies conducted? We looked at the objectives and basically saw that study authors were describing work that was for the benefit of human health most frequently than animal health. And then we started seeing some representation of this is for the benefit of environmental health, for plant health, for social environment health, more and more as time went on as well. But most predominantly for humans, which makes sense, I guess, funding-wise. What was the last one? And then I think we still have to do how. So for how, what we saw is that a lot of the studies were quantitative, but qualitative studies were also involved, and we started seeing that increasing over time. So the pattern is we see more and more diversity in One Health work over time. We also saw that a good amount of studies, I would say just over 10% of studies included stakeholder consultations as an active part of their work that they included in their manuscript, which is good. You want to engage with the audiences that benefit from the work or get different perspectives for One Health values.
Regarding your research, what was the best question that you got?
Yeah, I got a lot of really good questions. I think presenting at the World One Health Congress, there were so many different perspectives and global perspectives. But one that came up a couple times was, well, did you evaluate the One Healthness of the articles that were included? And that was a debate that we had, but we determined that we weren't in the place to define what One Health was when there's so many different ways that it can be approached and so many different ways it's conceptualized across the world. So we didn't define One Healthness, but we wanted to give this tool of, okay, well, these groups said they were doing One Health and this is what they did. So this community of global One Health researchers are saying that One Health is this to them and describing that. And people can move forward and interpret whatever One Health is to them through that.
After attending the One Health Congress, how did your perception of One Health change?
I think I wasn't aware of how well adopted One Health was globally. We have an amazing bubble within Guelph where there's so many passionate individuals, and then we all have this kind of very specific viewpoint of One Health. And then I went into this Congress and saw that There were public health agencies represented. There were individuals that do community work. There was a lot of representation from the UN, from WHO, WOA. What's the last one? FAO. There we go. So it just seemed like One Health right now has a lot of steam that I wasn't aware of. And I think that there's a lot of opportunities coming up for students, for people interested in One Health in many different spaces. They also talked a lot about funding opportunities because it was a very practical or applied focused conference at times. So that was kind of exciting to hear that there's going to be maybe some World Bank funded One Health work and all these different groups that are interested in supporting One Health sustainable work.
And what does One Health mean to you?
I think One Health is just an opportunity to connect with individuals that you don't usually connect with within your spaces. So yes, of course, One Health is human, animal, environmental health, as well as social environments and plant health and all these different things. But I think it's, for me, the crux of it is an opportunity to reach out and hear from different perspectives and make sure that you go beyond just hearing, that you're actually letting the groups, the communities, empowering them to take charge of these different initiatives and making sure that it's equitable and we're looking at things in new holistic ways that really take into account the big picture and all of the impacts that we have in this world.
What's one takeaway or piece of advice from your whole trip?
Yeah, so I learned that there's many different ways to do One Health, and I would just advise everyone to see what One Health means to them. Once you do that, find where you can implement One Health in your various communities, in your passions. I think that it can be a good tool to facilitate new innovative approaches to how we go about our research, life, practice, ideas for making the world a better place. I think there's so many different ways you can do One Health, and to be creative is a good thing to try.
And as a PhD candidate, what's one piece of advice that you would give someone wanting to do research in One Health?
Yeah, so I would say that don't be afraid to try out One Health. I think right now, or at least previously, we've been very disciplinary focused. Like, it's very common for veterinarians to be interested in One Health or epidemiologists to be interested in One Health. And I would encourage individuals to just, like, if you're outside of those disciplines, it's okay. You're the perspectives that can reshape how we do One Health going forward. We kind of need everyone on board. So if you're curious about it, give it a try. Talk to a professor that you think you might want to do research with and see if you can incorporate One Health in whatever you're doing, because the more examples we have of new ways to do One Health, I think the more the approach grows and the more we can be inclusive in what we do within this space.